This student is preparing to give a medication to a child who is using a syringe pump, which is used on all children whose weight is below 20 kilograms. That is the pump that will be utilized. The student's entering the room, preparing to give the medication. He's already informed the parents of which medication is to be administered at this time. That's to allow the parents to double check us for safety, and also so that they will feel as if they are involved in the process of the therapeutic actions that we're taking. The student uses the syringe that contains the medication to check the child's ID against the armband. The syringe and the armband have the child's name, room number, medical record number, and of course in the med room we've already checked the name, dosage, and volume in the syringe that contains the medication. That was better. The student is getting the tubing ready, and there's a little round circular thing that has pressure gauges in there that he inserts in the slit on the left, which we'll see. There it is. And that goes firmly in. Next, he's going to remove the old syringe that someone previously used to flush the line with. And we want to see that when we went in the room. We want to make sure there's no medication left in the line. So he's removing it from the pump, and he's already clamped it below the syringe. See the little white clamp hanging there in the air so that no air will get in. And now he's going to take the old saline syringe off and insert the syringe that contains his medication. And that just screws right in there. There's a little tiny flange on the end that fits right underneath a little gray tray there. That's how the machine regulates the pressure. Then he clamps it at the top and captures it with the little swivel clamp. And now we're ready to program the pump. He's going to check channel select A because that's the pump that his syringe is running through. And he will choose the size and the manufacturer of the syringe that contains the medication. And this is a 3 milliliter BD. He confirms that at the bottom. And the machine's so smart it regulates the pressure according to the manufacturer. Now he's going to select Guardrail's drugs. And there's a little brain in this machine that's going to double check the information that we load to make sure we're using safe administration. This medication is ceftriaxone rocephin. And he selected the generic name, and we'll tell the machine we're going to dial in milligram per kilogram. And then you simply dial in the numbers that the machine asks you for. It wants the dosage in milligrams. It wants the volume in that syringe, which we looked at before we loaded it, and it was, we'll see in just a second, 2.5 milliliters. The machine wants to know the patient's weight so that the machine's brain can check us. So we load that in, and then it tells us press next, and it's going to tell us whether that's okay. And it says that the dose is below the Guardrail's limit of 25 milligram per kilogram. Do we want to proceed? No. The machine just told us that we made a mistake entering the drug amount. It wasn't 120 milligrams, it was 1,200 milligrams. So the student went back, corrected it, reloads the numbers. Now we'll see if the machine is happy. Yes. It says you may now press start. So we look at our tubing. We make sure that we've unclamped the slide clamp. We are now good to punch start. And the machine has selected a time for us. The medication has finished running. It was 2.5 milliliters. The syringe ran it at 5 milliliters an hour, so 30 minutes later, we're done. Now we have to put some flush onto the machine, or else we'll leave all of our medication in the tubing. So we come to the pump. We clamp underneath. we remove the syringe that has no medication left in it. We forgot to clamp. If we didn't flush, we would leave about 1 milliliter out of our total 2.5 in the tubing rather than in the patient. That's why it's critical that we come and reprogram a flush for this type of pump. Okay, our medication syringe is being replaced with a new 10 milliliter pre-filled saline syringe. And we fit it in the, take the cap off, put it on the tubing. He's getting that little tiny air bubble that for some reason they package it with. He's getting that out, drying off the pump, and putting that little flange back underneath the little gray pump mechanism. And he's capturing the syringe with the slide clamp on the top. And the little swivel capturer. Now he's going to unclamp, and we have to reprogram the pump. So we're going to punch channel select. It says, what kind of syringe do you have? And we do have a BD10. So he's going to confirm that. And we're going to decide how much flush we want to use. It really only takes about 1 to clear that tubing. He punches basic infusion because just plain IV fluid is going in now, not a medication. So we decide for volume, we're going to select, well, he's going to put rate first. And he actually selected 60, which is too fast, so we'll pretend we didn't do that. What we want is for the 2 milliliter volume clearing the tubing to take about 15 minutes to run in. So we'd program it at a rate of 8 instead of 60 as he's put on there. We unclamp the tubing, punch start, and in 15 minutes we need to be back in there. The pump is now beeping at us, and it's reading across the screen infusion complete. So we take our finger and we press very firmly on channel off till you hear a quiet little beep, and then you will see the screen powering down completely, and we're finished.